please state your name and your affiliation.
Okay, I'm Vahakan S. It's spelled, my first name is spelled Vahakn. Last name is Shahinian, Shahinian. I'm an associate professor of medicine in the Division of Nephrology at the University of Michigan.
All right, outstanding. And they can't hear me, so you're going to need to repeat the question.
Okay.
What drew you to this event? Why is this event important to you?
So you're asking about what drew me to this event. I guess the bottom line is that certainly I was invited by Dr. Jerkovich to come here and talk, and I think one of the things that certainly one of the things that drives me and interests me is my work with the United States Renal Data System, which tracks kidney disease across the country, and similarly another project funded by the Centers for Disease Control, which is the CKD surveillance system. And both of those projects involve activities looking at monitoring kidney disease across the nation. And I understood that the project here was to do something like that, but looking within the state of Delaware and also within the healthcare system here at the Christiania Health System.
Well, along those lines, how will that benefit patients? So if a patient were to ask, why is this registry important? How would it potentially impact them? Could you share your thoughts on that?
Okay, so you're asking about how patients may benefit by perhaps a registry of kidney disease patients. From my perspective, it's a situation where really knowledge is power. It's important to have the information about what's going on in kidney disease in terms of the numbers of people that have it, being able to identify patients who have it that perhaps themselves don't know, or even their own physicians may not be aware. So understanding who has kidney disease, and then also being able to track how patients are doing gives an opportunity to kind of refine what practices are there and really try to direct efforts at changing the way practice is done towards improving the care of patients with kidney disease.
So in your talk today, what were the key messages that you want everyone to take home?
So you were asking about the key points from my talk today, and so I'd say a few things. One is, again, it reemphasizes the importance of having the information, the data, on what's going on with kidney disease. And during my talk, I talked about a lot of different data sources that allows us to track how patients are doing. So one is the importance of having information so that we can see who are the patients who have kidney issues and what kind of care is being delivered to them. The other thing that I stressed during my talk was the importance of really getting ahead of the problem, what I called kind of upstream effort. So kidney disease is a spectrum, and a lot of times we end up focusing on patients who are in really late stages, like those who are already requiring dialysis. But a lot of the key to trying to improve care is to identify the patients early and focus on preventive efforts at earlier stages before they progress to later stages.
Do you have any examples of success stories linked to your registry that you're in charge of? Do you have any examples of how that has been used or use cases?
So
I know that's a tough question.
So you're asking for potential examples, and I think the bottom line is that I don't have any direct examples, and I kind of see that as that's exactly kind of the opportunity. I think we're still in the stage of being able to, still trying to sort out how best to, identify the data sources that we can use in order to do this and the best ways to identify these patients. So it's still kind of fairly early in the game. Certainly there are various, through health various healthcare insurers. There have been examples of kind of case management where there are programs trying to get into the medical records and identify patients and kind of send messages to the physician that there may be an issue or problem like that. But this is something that still needs a lot of work and a lot of refinement to get it to work to work the way we're hoping it will eventually do.
Sure. And are you participating in the workshops?
I will be participating in the workshops this afternoon.
Are you a moderator?
No, I'm not. I'll be as a participant.
And so as a participant in the workshop, what are you hoping for? Where do you see, what are you hoping to hear? Is it patient perspective? Just share your thoughts about that.
Okay, so you're asking about what I'm hoping to kind of hear or get out of the workshop. And I think it's something you just mentioned, which is really to get a broader set of perspectives. I'm a kidney specialist. That's what I work with day in and day out. And I think having a broader range of perspectives that are represented here in terms of the audience, including nursing, patients, caregivers of patients, primary care physicians. So I think there's a lot of strength in hearing, those different perspectives kind of brought together. And I think that's going to be, one of the biggest things that I'm kind of looking forward to.
Okay. And one question is a little technical. You were talking about liberal and rigorous definitions for kidney disease. Are there any downstream implications in terms of mortality assessments or disability adjusted life years with that sort of technique? So if you have a liberal definition, does that increase risk or decrease risk because of earlier detection maybe? Or which definition seems, or do you have any information about that? Or any, if you don't have specific, it's like, what are your gut instincts telling you?
Okay, so you're asking about some details about this concept I presented, which was actually done in the Veterans Affairs database that we also work with, having to do with a quote-unquote liberal definition of kidney disease within that data set versus a more rigorous definition. And this kind of gets at some of the challenges in identifying kidney disease. And other speakers also talked about these issues in terms of it's hard within healthcare data to precisely define who has kidney disease and who doesn't. And so a lot of it is taking various data points and setting various thresholds for defining who may be more or less likely to have kidney disease. I think the idea is that the liberal definition captures a wider net, but may include people who are probably at lower risk, but probably still higher than those who are not captured in that net, versus the rigorous definition, which casts a narrower net, but probably identifies people who are particularly high risk. So what we haven't done yet, which we'd like to, and this would be ongoing work, is to try to more precisely define what happens in people who are defined in these various kind of buckets of definitions. But the anticipation would be that the people identified by the rigorous definition are going to be the ones that are at the highest risk, are likely to have the most trouble in the short term, whereas the other group may still be at higher risk than those not identified, but still important. And I think the idea is once we can, perhaps better define the implications of each, then a given healthcare system can decide how it wants to use that data. And it may be that it has a kind of a lower intensity intervention in those captured in the wider net, and a higher intensity intervention in those captured in the narrower net, where those patients are higher risk. So put more resources per patient in for those people, maybe some resources in the liberal definition.
All right, thank you. And are there any additional comments you'd like to make that you haven't been asked?
I think the only other thing I guess, so in terms of additional comments, I would just reemphasize something that I did during my talk as well, which I believe in, and it ties in with the issue of prevention as well. Is that I think primary care is a really important component of care for chronic kidney disease. It's not just about the nephrologist. This is from the physician end, and I think the bulk of patients who will ultimately go on to develop significant kidney disease, many of those patients early on, they may just be at risk for kidney disease, or they may have very mild forms where primarily they're going to be managed by a primary care physician. And maybe that's where we might be able to make the biggest impact in terms of preventing them from progressing. So I think finding ways to involve primary care physicians is going to be critical.
Okay. All right. Well, thank you.
How do you feel about the study, and who do you think will be the benefits? The patients, the caregivers, or both? The doctors, or both?
Well, I think. So you're asking about who do I think will hopefully benefit from the proposed study here, and ultimately I think what's important is, bottom line is the patients, and hopefully that's ultimately going to be the beneficiary. I think that what comes out of this may be processes that will help the other kinds of providers, be able to do a better job in that, in terms of helping the patients under their care. But ultimately, I think the important thing is the patient.
Thank you.
Thank you.